Diabetes and glasses. Alert. Stop wasting money now. Your vision could be at risk. Listen up if you're diabetic and wear glasses. This video could save you hundreds of dollars, and more importantly, it could save your vision. If I were you, I'd stick around till the end. Go ahead and hit that like button to show some support, and let's get straight to it. Hey folks, metabolic greetings. This is Dr. Anonymous. I'm an endocrinologist, and my mission here is to help you turn the tables on type 2 diabetes. What does that mean? A miracle cure? A magic pill? Nope. Unfortunately, that easy cure doesn't exist, and to be honest, I don't see much chance of it appearing anytime soon. Diabetes or reversal, in my view, is something practical and powerful. It's achieving better results. On your tests, feeling more energetic. Day to day, seeing those annoying diabetes problems shrink, and best of all, relying less and less on medication. We know the norm, unfortunately, is for diabetics to have so-so test results while taking a huge and often growing list of meds. That's not right. Bad or mediocre results despite lots of medicine is a clear sign the treatment isn't hitting the root cause. When you understand the disease and adjust your approach, the results come. Better control with less medication. It's within your reach, yes. You just need to learn how. I believe in this so much, and I see it's accessible to so many people, that our goal here is to help thousands upon thousands of people in this country reverse this condition. Fewer people suffering. And I'm inviting you to be part of this change. Start with yourself, and recommend this channel to every diabetic or pre-diabetic person you know. Those folks on the edge of the problem can nip it in the bud. There are so many people needing help, right? Probably tens of millions in the US at risk, or already diagnosed. It's a staggering number. So, let's get to work. Okay, today's topic is serious and affects many people. Diabetic vision. Oh, is that blurry vision of yours just an outdated prescription? Be careful. I want to tell you a story I've seen happen countless times over my years in medicine. It's the story of Mr. Joe. Mr. Joe isn't real. He's our virtual patient, but his case is based on hundreds of real stories I've encountered. And Mr. Joe's story has a golden tip for you, one that will protect not only your eyes but also your wallet. And these days, healthcare is expensive, right? Let's understand this situation, which I'm sure will interest you and make you want to share it. Here's how it went. Mr. Joe was invited by an old buddy to go fishing for the weekend, out at a cabin by the river. You know how these fishing trips with friends go, right? Actual fishing is just part of the story. What really happens is non-stop eating and drinking all weekend. Barbecue, beer, fried food, dessert, food galore. The guys might even get in the boat with their fishing rods, but you can bet a case of beer goes with them. Maybe you don't do these things, or maybe you do, but you surely know someone who does. Anyway, Mr. Joe went, happy as could be. He doesn't even like fishing that much, but he knew the party would be good. He lived it up, ate and drank without restraint, laughed a ton, caught zero fish, of course. He came back to the city on Monday, maybe a bit hungover. When he turned on the bedroom light to face the grind, he looked in the bathroom mirror and, where was it? He could hardly see anything. Everything was blurry, out of focus. He couldn't find the toothpaste on the counter, couldn't find his underwear in the drawer. Things were really bad. To give you an idea, he was afraid to drive and had to ask for a ride to work. At lunchtime, worry started to set in. Shoot, I think I need to get new glasses. My prescription must have changed suddenly. I'll go to the optical shop and sort this out. So, does this story sound familiar? Has something similar happened to you or someone you know? Suddenly waking up one day with completely blurry vision, thinking, whoa, what happened here? I need new glasses right away. Mr. Joe went straight to the optical shop. The staff there, very helpful, did those quick reading tests and said, "Mr. Joe, your prescription really has changed. Your old glasses aren't working anymore. We'll have to make you new ones." After all, you walk into an eyeglass store. What are they going to offer you? New glasses, obviously. But there are two critical problems with Mr. Joe's approach, and many people's. The first, which I think is the most serious, is that no one is making a real diagnosis of what's causing the blurred vision. How do you expect to solve a problem if you don't even know its name, its root cause? Nobody stopped to truly investigate what was happening inside Mr. Joe's eye. Imagine doing this with your car. A strange light comes on the dashboard, different black smoke starts coming out the tailpipe, and before even taking it to a mechanic to find out what's wrong, you just start randomly replacing parts, buying new things hoping you'll hit the right one? It's the worst way to fix things, agree? You'll just waste money and maybe make the problem worse. That's why we call a specialist. And here's the crucial point. For eye problems, especially in diabetics, the specialist is not the primary care physician, not the endocrinologist, like me, and not even the optician at the eyeglass store. If you go to these professionals, they don't have the necessary equipment to look at what's happening deep inside your eyes. The specialist for this is the ophthalmologist, the IMD. You know what the exam with them is like, right? Often they have to put in those eye drops to dilate your pupil, the black part in the middle. Why? Precisely so the doctor can see way in the back, using special instruments. They can see the different layers of the eye, the health of the blood vessels, the internal pressure, the condition of the retina, the lens. They can identify potentially serious problems that might be starting. Was there a small bleed back there, diabetic retinopathy? Is the problem in the natural lens of the eye, cataract? Is the eye pressure high, glaucoma? Only the ophthalmologist can tell because they are the specialist in this tiny, complex part of our body. They know everything about that little eyeball. When you skip the ophthalmologist and go straight to the optical shop to get new lenses, thinking you've touched up your vision, that it's good enough just to get by at work, you're taking a huge risk. First, there could be something serious happening inside, like diabetic retinopathy, which can lead to blindness. And you missed it. You missed it because you didn't go to someone who truly understands and has the tools to see it. If it's something that needs urgent treatment, time is running against you, and your chances of saving your vision decrease every day that passes without the correct diagnosis. It's what we call missing the boat in medicine. And second, what's the chance your new lens, your new prescription adjusted at the optical shop, will actually fix the problem? If the root cause of the blurriness was inside the eye or caused by something else, as we'll see, zero. You'll just waste money. You'll buy new, possibly expensive glasses now, and soon enough your vision will blur again, or the real problem will progress, and you've lost both time and money. So, what's the right way to do it? If Mr. Joe had gone to the ophthalmologist first, the doctor would have looked inside. Let's assume, in his case, there was no catastrophe happening, no advanced cataract, eye pressure was normal, no glaucoma, and the back of the eye, the retina, showed no signs of bleeding or damage from diabetic retinopathy. In other words, the main causes of permanent vision loss in diabetics weren't present at that moment. Great! But the vision was still blurry. What else could it be? Then the ophthalmologist, or the endocrinologist, should think, what were your blood sugar levels like the past few days, Mr. Joe? Remember the fishing trip? A weekend of excess, beer, which turns into sugar, fried food, hearty rice dishes, dessert. Mr. Joe didn't hold back. His blood glucose surely went sky high. And here I want to explain something you might never have considered. You know when you take a glass of water and dissolve a lot of sugar in it? Have you ever noticed the water looks different, maybe a bit cloudy? You can see little wavy lines moving in it. It's clear there's something dissolved in that water. It changes its density, its refraction. Agree? Well, the ito Exact same thing happens with the little bit of water inside your eye. Our eye is basically a little ball filled with fluids, aqueous humor and vitreous humor, with the lens, the crystalline lens, and other structures floating in there. When your diabetes suddenly goes out of control, when your blood glucose spikes very quickly, like after a weekend binge, that little bit of water inside your eye also gets sweet. The excess glucose enters these fluids. Nobody knows the exact mechanism 100%, but the practical effect is similar to the glass of sugar water. These waves of sugar in the eye's fluid interfere with the passage of light. Think of your eye like a movie projector. Light enters from outside, like the projector beam, passes through the eye's lens, and needs to form a sharp imageway in the back, on the retina, which is the movie screen. But, in the cinema, there's clear air between the projector and the screen. Imagine if there was smoke in the way. The projection on the screen would be horrible, all blurry, out of focus. The same thing happens inside your eye when your glucose is very high. The light entering has to travel through this sweet water. It hits these glucose molecules, gets scattered, bends differently. And just that, this subtle change in light refraction inside the eye, is enough to completely blur the image that reaches the screen, retina. Your vision goes out of focus. And the worst part, if you go to the optical shop at that moment of high glucose and get new glasses to correct this temporary blurriness, you might even feel a momentary improvement, a touch-up. But then, the next day, your glucose drops a bit, or spikes even higher. The sugar concentration in the eye fluid changes again, and boom, your vision is all blurry again. The new glasses are useless, and there you go, spending another few $100 on another pair of glasses. See the trap? It's an endless and very expensive game. So, the what golden rule is this. If you feel your vision changing, getting blurry, finding it hard to see near or far, especially if you're diabetic, do not go straight to the optical shop. Folks, go first to the ophthalmologist, the specialist. It's your vision at stake. You can't play with fire or look for shortcuts. What if it's something serious inside? Early retinopathy, glaucoma? Do you think your neighbor with her herbal tea will know what to do? Do you think the technician at the optical store will save your vision? Of course not. They have no way of knowing what's really happening deep inside your eye. First, because it's not their specialty. Second, because they don't have the necessary equipment for a complete exam. If there's no correct diagnosis, there's no correct treatment. The right way is, go to the ophthalmologist. They will examine everything. If there's no serious disease, retinopathy, glaucoma, significant cataract, great. The next step is to say, control your glucose. Get your diabetes regulated with diet, exercise, correct medication. Once your glucose is stable for a while, weeks, maybe months, then you go back to the ophthalmologist for them to check your vision prescription again. If you still need adjusted glasses at that point, then you get the definitive glasses. And what if the initial exam reveals you have cataracts? Stay calm. Usually they wait for it to ripen, as people say, and if necessary, surgery is performed. Oh, but the problem was on the retina. That's more serious. More than ever, you need to control your diabetes rigorously, or you could lose your vision. And you might need specific treatments like laser or injections in the eye. Who will know this and recommend it? Only the ophthalmologist. Not even me, as an endocrinologist, can do that. It's not my field. I don't have the machines. It's like having an engine problem and taking your car to the body shop. It won't get fixed. Each specialist to their own field. Did you get Mr. Joe's message? Don't mess around with your eyes. And the worst thing you can do is try to put a Band-Aid on the problem, using new glasses as a quick fix for something you don't even know what it is. At the very least, you'll save yourself a good chunk of change on new glasses that wouldn't have solved anything. Agreed? Message delivered. I hope Mr. Joe's story helped you think. Take good care of your eyes, just like you need to take good care of your feet, your kidneys, The diabetic has to take care of many things, right? That's why it's best to go to the root. Take good care of your diabetes. Look at how much trouble and suffering you'll save yourself down the road. Now take this video and forward it to that stubborn friend or relative, the one who keeps looking for shortcuts for serious matters, who doesn't see the doctor properly. You can't afford to be stubborn with your health. Subscribe to the channel to see the next videos, and remember we have a huge library of content here on our page, exploring various aspects of health and diabetes. Feel free to binge watch. There's new content coming out regularly. A big hug, and see you in the next video.